Have you ever wondered why some of the patients, when they're given treatment by their doctor, or they're given a prescription to go and buy their medication at the pharmacy, don't take the treatment? I mean, they've gone through the trouble of consulting and they're given the medication. And they trust the doctor, but they still don't take the medication. Or the medication they take doesn't quite work. Have you ever wondered why? Today, that's what we're going to have a look at. Right, let us divide the reasons into, there are those that can be doctor related and there are those that are patient related. Let's start with the ones that are doctor related. What could be the reasons from the doctor's behavior point of view? Maybe the doctor didn't quite take time to take all the history in terms of getting the background of the patient as to what medical conditions they have, including what their expectations are of this consultation. What's the real reason why they came here? And all of that. And the other reason from a doctor point of view could well be that the doctor didn't quite take time to communicate to the patient and clearly explain what condition this is that they're suffering from and the reasons why they actually are choosing the medication they're choosing for the patient. And then explain it in a manner that is not so technical, in a manner that is not too medical, in a manner that the patient will actually understand, whether in their language or in the language that is common between the patient and the doctor, preferably in the patient's language, their mother tongue. That usually is the best way. But maybe there's a common language, as would be the case. Maybe the other one speaks a different African language from the other one, and therefore they communicate in English. In some countries they will communicate in French or whatever. But the issue here is that you must communicate clearly as a doctor as to what the patient has, what is the diagnosis, and why you chose the kind of treatment that you have chosen as a doctor. Okay, now let's come to the patient-related reasons. The patient may be too scared to ask the questions. Secondly, they may have come in with a very wrong idea. A lot of patients are not empowered. They think a doctor is supposed to tell them, it's the doctor who's talking. They are supposed to sit here and figure out what is happening. No, when you go to the doctor, you give as much information as you can, as much background to whatever you're suffering from, and then you ask the questions when you don't understand what the doctor is saying. Some doctors, they explain things based on how much questions you ask, how many issues you have with what they are saying. So it's important that as a patient, when you don't understand something, don't let the doctor go on, because you'll be even more confused at the end. That's the first part. The second part is that, okay, fine, you need to ask the doctor, why did you choose the medication that you are choosing for me? What other options do I have? What would happen if I don't take the medication? What are the possible complications that may arise from this disease? And what are the possible side effects of the medication that you are giving me? How does it work? How often must I take it per day? And what must I take it with? What medications should I not mix it with? And what other things that I may be eating or drinking that might coincide with my medication? Other things that the patients might have a problem with. You might find that a patient, for instance, the diagnosis that the doctor told them about scares them. So they are still struggling with accepting the fact that the doctor said, I've got this condition. Some people think having HIV, for instance, is a death sentence. There are people who are still thinking like that. Someone would be told that you have a heart condition. Just because they heard the word heart, for them it says, I'm dying. So they basically switched off from the time the doctor mentioned the diagnosis. So that means they are scared of it. In that situation, some of them, by the way, you find that they've got their own prejudices against that particular condition. You might have laughed at somebody, you might have judged somebody who had that condition. Now suddenly, you are the one who's having that condition. So in that instance, you are struggling to accept that this is the condition that I have. And sometimes you might find that whatever the doctor has said, has chosen as the best method, or they think is best for you in terms of treating this, might be culturally or even religiously unacceptable to you. But then you need to communicate that with your doctor so you can explore a lot of options. So it's important as a patient to be open with your doctor. The consulting room is exactly that. You consult with your doctor, and the doctor also consults with you that, are you finding this, what I'm prescribing to you, and say you take it in this way, acceptable to you, because maybe there may be another option. So it's very important to understand that compliance, for the most part of it, or the lack of compliance rather, comes from the fact mostly because those factors I've just outlined have not been ironed between the patient and the doctor. A patient who is most likely to follow and take the treatment as the doctor has described is the one who has asked the correct questions, who's fully understood the diagnosis and has understood it, and has understood why the medication was chosen, and they've been told that how long it will take to take this medication. Is it something that you take for a week, 2 weeks, a couple of months? Is it chronic, as in you take it for life? All those things. And the necessary changes in your diet, in other lifestyle, what we call lifestyle modifications that the doctor might have advised you with, then generally the patients who will comply with treatment are the ones who have gone through all the processes. As I said, also there are cultural issues that the patient might have with regards to the treatment that was prescribed, or accepting the disease that the doctor has said the patient is suffering from. So what do you do in that case? You can ask for a second opinion as a patient if you're struggling to accept what the doctor was saying, or you're not sure that you trust what the doctor is saying. You can ask for a second opinion from a different, suitably qualified doctor for that condition that you might be suffering from. The other part is you do have registered therapists or psychologists, people who can actually counsel you to kind of make you accept the condition, and you tell them what you're struggling with. Maybe they are more suited for that than your doctor. You might find that they are better equipped in terms of counseling you to accept and understand what you're suffering from, especially if it's what you call a dreaded disease, or it's medication that you might have to take for a much longer time than you would want to take it. So those are the main reasons why people would not be compliant with that treatment, or they would not take it the way they're supposed to, or not even take it at all.